Good afternoon, everyone, and good morning. Um, my name is Linda Kakolwa. I'll be your moderator for today and project lead for Building Pandemic Ready Teams. We are honored to have you all today. Thank you for making time for today, and we are really happy to have you today. For just 1 hour and a half, we're going to run you through the Building Pandemic Ready Communities project. Today, I'm with my colleague, Mr. John Beku, who will introduce himself extensively later. But without further ado, I would like to welcome our Executive Director, Mr. Kennedy Utondu, for opening remarks.
Just a minute. Put on the thing. Yeah. Thank you, ladies and gentlemen. I think in some countries this is the afternoon, others maybe still morning. I think almost the same. Members, on behalf of Building Pandemic Readiness.
Kennedy is breaking. I don't think you can hear him clearly.
We appreciate your time and continued commitment to strengthening pandemic preparedness and respond in Rwanda and Sierra Leone. This project is grounded in understanding the communities at the center of through this initiative. We aim community system, enhance engagement, public health emergency. We have already taken important initiative steps. We are delayed a bit by technical issues, but now we are on a momentum, including conducting today's session to align on our shared vision and collaboration as we move into the implementation. So thank you, members, for taking your time, and I'm sure we shall be able to catch up. And I want to promise team at Yanas
Okay, we were getting a difficult time to hear him, but I think he will also give us closing remarks as we fix the technical issue. I would also like to welcome.
It went off. Just came back again. Maybe to go.
Thank you. You can go ahead.
Okay. I've just got a new piece. Allow me to use the new PC. My the other one had issues. Once again, ladies and gentlemen, in the afternoon or morning to some other part of the country, this is Kennedy Utondu, the Executive Director of IANASO. I warmly welcome you to this virtual orientation for the Building Pandemic Ready Committee Partnership Pandemic Preparedness Ready Community Project. Here we are intending to prepare our community to be able to be strong and strengthen them to be able to handle the pandemic. We appreciate your time and continuous commitment to strengthening pandemic readiness and respond in Rwanda and Sierra Leone. This project is grounded in understanding that the communities are the center of effective health security. Through this initiative, we aim to strengthen community system, enhance engagement, and support more coordinated and inclusive response to public health emergency. We have already taken important initial steps. As you know, we delayed a bit, but we promise you at IANASO, the team is ready and committed to ensure that the first quarter and the second quarter is completed in this period of the second quarter. Then two, as far as we are concerned, we have tried to conduct some of our activities as I speak now. Rapid assessment document has been provided for review. And also today, I look forward to hear from the members what we need to do and be able to implement the remaining activities between this month and part of the next month. Thank you, members. You're all welcome. Back to you, the chair of the session, John or Linda.
Thank you so much, Kennedy, for your wonderful remarks. I would like now to welcome representation from AHF Rwanda for a brief opening remarks.
Hello, can you hear me, Linda?
Yes, we can, Lambert.
I think I was muted. Sorry about that. So thank you, Linda, for the warm welcome. I wanted to acknowledge that we first of all appreciate the attendance of majority of the local NGO that we have invited, and we are truly grateful for their positive response. Some of them got the invitation with a bit of delay, but we wanted to thank them for just attending this important meeting. So Rwanda is like any few country on this continent has been hit by the two pandemic in the last span of 5 years. We had COVID-19 back in 2020 and 2021. And of recent, in September 2024, we had the Marburg pandemic outbreak here in Rwanda as well. So I would say that this webinar and project come at the right moment. It is like an opportune moment that we do discuss about how can we strengthen the capacity of our community so that they can respond positively to any further pandemic that would hit our country. So I am very grateful for this local NGO that has been able to respond positively to our invitation. So we are not able to accommodate as much as we can, but for the few 20 NGO that has been selected, I would say that they has been selected because of their solid community reach in this country, and also for being aligned with our programs. Some of them have been working with HF for the last 5 and more years on different projects and programs. And I would also say that some of them are continuing to work with us. But we want to take this next step to be able to engage on different programs which are on pandemic response and preparedness, and to be able to have our community engaged by empowering communities for the pandemic preparedness, enhancing public awareness and engagement in PPR, and also be able to develop sustainable community-led tool for the PPR project that we are jointly having with EANASO, AHF, and local NGOs. I thank you for your attention and look forward to work with you all. Over to you, Linda.
Yeah, thank you so much, Lambert. AHF Sierra Leone, you're welcome for your brief opening remarks.
Thank you, Linda and team. Please kindly check the participant list. I still get messages. People want to join the meeting, let them in. Thank you. And good morning and good afternoon to everybody, especially partners, CSOs from Sierra Leone and colleagues from Rwanda. I bring greetings. And Madam Miata would have loved to join this webinar, but she's currently engaged in another pressing task. So she sends her regards. It is indeed the right moment to start talking about building pandemic-ready communities. Given the context of Sierra Leone, we had experienced, public health emergencies, and those experiences has taught the country some powerful lessons, especially about preparedness, community trust, and coordination. If you look at the devastating effects from what Ebola left the country, Sierra Leone was among the hardest that got the heat of Ebola in 2014, recording nearly 9,000 and having over 4,000, close to 4,000 deaths. That severely weakens the Sierra Leone health system. Later, challenges of COVID-19 sprang up, and recently we are battling with Mpox. We have learned that over the years, resilient health systems cannot function effectively if we don't have strong community engagement and involvement. And those outbreaks, especially in low-income countries like Sierra Leone, continue to put us in the limelight and the mercy of those emergencies. During Ebola, Sierra Leone experienced significant loss of lives, economic disruptions, pressure on the health system. And it was a lot that the country had to bear. So today we are here to discuss building pandemic-ready communities. I think this is just the right time for us to be able to look at a journey like this. As AHF, we know we have been part of this journey in providing and supporting the health workforce and looking at priorities for strengthening community resilience. And to the partners who we have invited to this meeting, we want you to know that you being here is both strategic and essential. And if we are to build a pandemic-ready community, it means that each of us should be able to bring unique expertise, community presence, and practical experience that we have gained from responding to public health emergencies. And that is why we are urging that you kindly participate actively and contribute to the discussions that are going to be held here today. And we believe that if we collaborate and share the coordinated effort to form a major and a strong alliance in building communities that can be ready to tackle any pandemic in the near future. Our experience is enough to tell us that this is a topic that we all should hold in high esteem. I want to thank the ENASO team for considering Sierra Leone in this project, and we are also looking forward to working with you effectively on this project. Thank you, and over to you, Chair.
Okay, thank you very much, Esther, for your wonderful remarks. I think we can go ahead and start. Let's just go over some few house rules. John, next slide. Yes, I see you already utilizing the chat box to introduce yourself and network. That's a great thing that I'm seeing you guys doing. Wonderful. If you have any questions during the meeting, you can utilize the Q&A box, but also you can use your electronic hand to raise your hand, and I'll be sure to pick it up. And also, if you're automatically muted at the moment, but if you're given a chance to speak and you're done speaking, just remember to turn off your mic so to avoid any confusions. And that's all from me for now. Without further ado, John, you're welcome to introduce yourselves and carry us through this session. Welcome, John.
Many thanks, Linda. Thank you, colleagues and friends, for making time for this session. And thank you, Esther and Dr. Rangara, for your very insightful opening remarks. This has set us the scene, actually, for this discussion today. So, colleagues, you represent different communities. We are community organizations, so we are very much happy to host this project and to host this meeting today. This is one of the meetings that introduces the project. And as the previous speakers, both Rangara and Esther, they've mentioned that I think without communities, it's very difficult to address the health emergencies and pandemics in our region. So this project actually squarely seeks to respond to that gap in our health systems. And it's not just in these two countries, actually. If you look at most countries in Sub-Saharan Africa, and also some parts of Southeast Asia, Eastern Europe, I mean, there's need for enhancing community engagement in health emergencies and PPRs. From the government side, I think we all appreciate there is a very good organization, very good plans. They have emergency response plans and strategic plans. They train workforce and all that. But the linkage between that and utilizing the voice of communities is where there's a gap. And we now from the communities, from the civil societies space, I think it's time we recognize that gap and we jump in and contribute and participate in PPR and health emergency process. So that's why we are all here to introduce the project, to discuss on how we can implement it together as a team. But the main focus is how do we enhance the engagement of communities in health emergencies and pandemic preparedness. So as Linda has mentioned, my name is John Beku. I'm technical advisor at EANASO. And for this project, I'm the technical lead working with Linda and the team at EANASO. So for this first session, I would like to quickly give us a background on why we just look at the context on why we need to do this as a team. I think we understand, I think even the previous speakers have mentioned this, that there's a lot of recurring of health emergencies in the region. We also have new pandemics. We've just come out of one, the COVID-19. But we've also had some pandemics that come and go. Health emergencies also persist in our system, in our region. That one is evident. We can't run away from that. But having said that, for example, if you take one step back, the Ebola, for example, and Sierra Leone can give us a very good experience there, community experience. We've seen that happening and recurring. And the country health systems, as Esther has mentioned, the health systems are really, really fragile. We have the health systems that is, on a normal basis, it is struggling to provide services to people. Now, can you imagine introducing a health emergency or a pandemic? That becomes very chaotic, and sometimes the health systems break down. And I think in Africa we are lucky. Ebola COVID didn't hit us as the way it hit Europe. Can you imagine if it was to that extent? I think our health system would have. Most people even expected our health systems to crash, and they were saying, "Okay, just wait for this to get to Africa. We will see. Africa will be wiped out." But I think we thank God we really went through that without comparatively without a very big damage as compared to our brothers and sisters in the north, especially in the Europe and North America. So we've seen these pandemics happen, and they happen, and we are not guaranteed that this is the end. But also health emergencies as well, the things that happen on a daily basis in our countries, and all these things, any event, any public health event happening, it always happens at a community level, at a household level. So it is the communities that are there to experience it firsthand and respond. So we've seen this pandemic happens, but there are a number of things that we have experienced with communities. One, we've seen the communities, they are actually the first responders, as mentioned. Can we all remember the time HIV started, when we didn't have medication? Once it's confirmed an individual is positive, then you're just told to go home. That's when we all, I think for those who are old enough in this meeting, you remember the very famous project that we used to do, home-based care, became very popular. So communities now, it is now the job of communities to handle that epidemic. So HIV communities played a very critical role until treatment came up. Then when treatment came up, we were at least most of that care moved to clinical settings and facilities. But communities are always the first responders, always, because an event happens at a community or at a household level. Communities are the most affected. And we are all honest in this meeting, I think they are the least, community organizations, CBOs, NGOs are the least resourced, least financed to handle and go through a pandemic. Then we also see in our region where we have the weak community engagement and the preparedness systems that limit effective response. That structural arrangement on where communities come in is a bit weak. So whenever we have a health emergency, whenever we have a pandemic, it's very difficult for communities to step in. Because the system, that linkage, that bridge between the formal structures that we have and the community is a bit weak. So what we need to do is now to look at how can we localize response to epidemics and health emergencies in our countries, in Rwanda, Sierra Leone, and the rest of the countries. How are we able to bring this response to be prepared and to respond at our level, at our grassroots level, and ensure that community-based organizations, CBOs, NGOs play a more leadership and effective and very active role in the planning, implementation, monitoring of all pandemic preparedness and health emergency plans at country level. So we've seen, yes, we have limited community awareness. That is but the reason why all these other challenges we've seen here is because one, awareness itself. Let's start from there. I'm sure we are around 55 or 50 colleagues in this meeting. If you ask us how many are aware of the international health regulations, we will have few. And we will still have some people who are not aware of the international health regulations. So how do you expect communities to start stepping into this discourse when there's that awareness itself in the beginning is limited? So that's one thing that we need to look at, awareness and for communities. So that is one of the biggest gaps. To start with, you need to be aware, you need to be knowledgeable, and people need to be involved in the PPR processes at country level for them to be able to contribute. Then we also have structures at community level that do a lot of monitoring. But this monitoring is actually not brought on board in terms of surveillance and early response system. I think Rwanda, Sierra Leone have interacted with your Global Fund grants. You are all implementing the CLM in our countries. But how are we using these tools, now linking them to now start talking about health emergencies and pandemic preparedness? So we need to also scale up that as well. So we have structures, weak community structures for surveillance and response. But it doesn't mean we don't have the structures. For example, CLM, we have it, and it's being implemented by most of us in HIV, malaria, TB grants supported by the Global Fund, and also some of the programs that were supported by the PEPFAR. We have that. It's been grown, it is strong. But the linkage now to how can we use this tool as a very valuable tool to play a key role in early response surveillance. Then inadequate integration of community system into national emergency frameworks. Yes, we've seen CLM. How do we bring it on board to the national frameworks? We have a lot of data communities. We have community health workers as a resource at a grassroots level. How do we bring them on board to be able to integrate them into the national frameworks for PPR? And please, I also wanted to mention that colleagues note that the Sierra Leone government, the Rwanda government, they are very good strategic plans to address pandemics. Trust me, I have read before when you started this project, there's a lot happening from the government side. Sierra Leone has a fully fledged, established public health institute, and which is responsible for pandemic response and health emergencies. Public Health Institute, fully fledged. Rwanda, that role I think is being played by the national laboratories. It's working very well. The engagement of the public sector entities is perfect. If you read the last joint external evaluation, and this is the report that my colleague Kennedy mentioned that we did, you look at the last JEE, joint external evaluation that was happened in Sierra Leone. It's very well, the structures are there within the public sector. So the question is how are these structures that are very beautiful within the public sector linked to community? Okay, how can they be able to also bring on board the value that communities have and the community infrastructure that is already there to come and help? So that's one area that we need to also look at. Then the other issue is the tools that we have How sustainable? I've just mentioned the CLM that we have, and you will see it is already donor funded, very donor specific. So the question is, if the donor goes, for example, the PEPFAR that we've lost, all of us in the region, some of it had CLM funding. So the areas and the community organizations that are doing that CLM now closed, okay? So those are the issues that we need to look at. Sustainability of community infrastructure. How do we make them more sustainable to be able to respond to some of these issues? So I think this also brings us, answers these questions that we are looking at. One of them is communities are central to early detection. I mentioned that it's happening at home, it's happening at a village level. So we are better, as communities, we are better positions to participate in the early warning, early detection system. Risk communication, guys, I think you all see this every day. And I think it was very evident during the both Ebola and COVID. Risk communication. And this is one of the critical indicators in pandemic response and health emergency. Risk communication and community engagement is one of the indicators within the JEE, the international health regulations. Now, you remember DRC Congo, where when it came to taking the COVID vaccine, it literally almost 90% of the country rejected it. Communities rejected, and not just Congo. Even in the US, I think there's some people believe that they shouldn't take that, the COVID-19 vaccine. And also in our countries, I think there are some people we have friends who have not, still don't feel comfortable with the vaccine. So, but when this happens to a level that it hinders a response, then it becomes a concern. Like many countries, that if you have a whole population that is not vaccinated, you see that we don't achieve the herd immunity, then issues go wrong in the next pandemic, or if this epidemic recurs. So risk communication, how does that come in to address that issue? If we develop vaccines and we don't involve communities, colleagues who are here, if you are not involved in mobilizing, ensuring there's awareness at community level, right communication to the communities in terms of prevention, how do you, issues around washing your hands, using soap, all those things. If communities are not engaged to talk to communities at household level, at community, grassroots level, then no matter what preventive measures we have, they will not be able to work. So risk communication. Colleagues, I think we play a more critical role in risk communication in health emergencies. We are better positioned to communicate the right information to communities, and also to influence the uptake of those kind of services or initiatives that are brought in by the public sector. So communities, this is the reason why we need communities there, okay? Then behavior change. Also, there are some things that also exposes communities to some dangers and health emergencies. So we are also better positioned to address that issue of behavior change at community level. So if we strengthen, you see, we've seen this, our capacity as communities, but so if we strengthen these community systems, we know we're going to have faster response. That is very obvious, because the moment we have very good surveillance, community-led, it's easier to detect and easier to respond. We reduce transmission, of course, and then improve trust in the health systems. If you walk away from epidemics, health emergencies, pandemics, just come back to the usual vaccination, children. Some communities still don't take it up. But the moment you put in communities, you will see uptake of this going up. So the trust in health systems also is also very weak, but communities are in a much better position. All of us who are seated here today, we are far much better position to address this trust issues within communities, uptaking of government policies, to implementing them, and ensuring that at least we respond effectively. So why this project now? So that's the background where we are coming from, the issues that are within us. So AHF, we are very glad from Yanaso point of view, and also I think from our colleagues now, the community partners in Rwanda and Sierra Leone. We're very grateful to HF that came up with this initiative to support strengthening the capacity of communities to engage in PPR, pandemic preparedness and response, and health emergencies. So we are very grateful to our colleagues, AHF colleagues who are here. Thank you so much for putting this opportunity for us. So this project was initiated by our friends, AHF, working with and implemented by EANASO. But the main objective is to ensure communities are better prepared to participate in PPR processes. So we look at the project in terms of how is it structured, in terms of what does it want to achieve. With the financial resources from AHF, we have a critical 3 layers of activities. We'll see them in detail as we go through. The first part is to have this awareness, capacity building, training, and all that. So we are introducing this project. Then the first part will involve a lot of engagement, talking, sharing documents, sharing resources, training, and all that. Then what do we expect to achieve from all that? Will, of course, to increase awareness and improve skills and coordination. So the NGOs, CBOs who are here today, who we are working with under this project, we expect by the end of this is to at least have some awareness internally, and the people that we work with and they represent at community level of how do we engage in PPR. Pandemic preparedness and health and responses. How do we, what tools are there, can we access? So we expect to have that as an output level. Outcome, we have, of course, stronger community systems. Our CLMs, whatever level they are, we should be able to enhance. EANASO worked with the Global Fund towards the end of last year to strengthen 5 countries, actually. For example, Nigeria, to integrate PPR into their CLM. So we hope at the end of this project, as an outcome, we can be able to have the appetite for community organizations to be able to integrate PPR into our ongoing community systems. One of them is the CLM. So for all of us who are here, some of those who are implementing CLM and the Global Fund or any other support, you can take this as an opportunity to move a step further and say, you know what, we are going to integrate elements and indicators of PPR into our CLM so that we can also monitor that data. Sierra Leone, I think you participated in this project of the Global Fund integration of CLM. You worked with the Africa Alliance. The lead organization in that project was EANASO, but the other consortium members, one of them is African Alliance, and they implemented the integration of PPR into Sierra Leone CLM mechanism. We will share, there's a full online training content, which we will also share with you. So at least you can also access it. That was developed by African Alliance under the leadership of EANASO. Then, of course, we hope to have resilient pandemic-ready communities that can easily and very quickly play a very key role in surveillance, early detection, and very easy, swift, effective response, and giving right information to communities and integrate into the public sector mechanisms for PPR and health emergencies. Remember, I mentioned most governments, Sierra Leone, Rwanda, the governments have very good structures for pandemic preparedness and health emergencies. Now we hope by the end of this project, we should be able to think, how do we now participate in those frameworks and structures of public sector and be a critical partner in pandemic preparedness and health emergencies. So the project has now we are getting specific to the project. I just wanted to share this background and context. The project specific is to strengthen the communities. The goal is to strengthen communities' capacities in PPR. Just our capacities to be able. In capacity mean awareness, we have the knowledge, we can develop the tool, we can upload it into our advocacy agenda, and we can engage directly with public sector. Then to achieve that, we have 3 specific projects. One, of course, that is capacity building, which is a community, power communities for pandemic preparedness and response. That is, we'll break it down in the next slides. And we also need to enhance public awareness and engagement in prevention. The first part is more of a capacity building. The second one is more of creating awareness, and develop and disseminate tools, and that can be able for us to be able to engage effectively. We'll engage in advocacy. How do we position communities? Having the role of communities in our countries to play a more effective role in PPR processes. So that's what the project is. We've seen where we want to go in terms of impact outcomes. Then we've specifically seen what project's goal and objective will lead us to that. Yes, so I would like maybe to take a break here, and Linda, if there's any comment, any question from this first introductory part, so before we go to the next session that breaks down the project in specific components so that colleagues can pick it up.
Okay. I do have few questions in the Q&A box. There is a question from Samuel Koroma. How long is the project going to last? And what are the strategies to ensure that CBOs take the lead in the implementation of the project? Yes.
Okay,
and
so yes, so because I can't see the question, it will be easier for me to maybe quickly respond to that.
yeah.
Yeah, so also Linda, if you want to chip in, you can also quickly respond if you want to.
No, go ahead.
Okay, so how long now? That's the unfortunate bit, but we can all work together to make sure we do design a much deeper and longer program. Currently, the HF has been very gracious, and they've given us a project that ends in December to go through these 3 projects objectives till December. But as advocates, we are all advocates in this group. We can be able to, towards the end of the project, we can build another more effective program and work with our stakeholders, including AHF, and reach out. And as a community, we can form one movement where we can now look for more resources to put more work towards this and have a more longer term project. How do we ensure we are all participating? This project, the design and the implementation arrangement is highly participatory. We are introducing it today, but we will walk the journey together as colleagues. We will co-create. We will have a workshop, a face-to-face workshop to co-create, and we will implement an advocacy component of it as a team. So that co-creation, we will meet face-to-face, sit down, and go through this material, and then also sit down and say, what advocacy issues around PPR do we want to implement? Then we will develop them as independent organizations, understanding the communities that we work with. So it is highly participatory, and we will engage you and ensure the communities, the organizations that are participating in this project take leadership in that. Yes, Linda?
Okay, thank you. Should we take more questions, or you want to go ahead first?
Yes, we can take more questions, and then maybe 3 more, then we close, we go ahead. 3 more.
Perfect.
Yeah,
Okay.
we can also allow people to talk so that we hear voices from Rwanda and Sierra Leone.
Yes, we have a hand from Abubakar. I'll allow you to talk, and then followed by Dr. Dale.
Yes, Abubakar.
Hello.
Abubakar, welcome. Yes,
Hello,
we
can
can.
you hear me?
Yes,
we can
can.
hear you loud and clear.
Okay, thank you so much. Thank you so much for this initiative. My name is Abubakar Bangura. I worked for the African Youth with Disabilities Network. I just want to thank you all for this wonderful initiative, because for us, we've been through it all. Like Esther mentioned, the Ebola pandemic. I think one of my worst experience during that time, we had one of the last districts that was Kabala, which was the Koinaduku districts, Kabala town to be specific, which we went in when there was an openness, and because anywhere that any district that the virus struck, they will close that district. They will close that district down. So we were in there and we were closed down, and it was very difficult. So I was just reflecting those areas. But however, what we are trying to do, I think we are in the right place, because when you look at you measured about communication risk and even the behavior of the behavior of the community itself, which pose very important challenge in our own case currently. Because to be honest, as John mentioned, we do have structures up to the recent virus or pandemic that threatens us. We see the reactivation of various pillars to ensure that we mitigate it. But yet we still have community doubts. We still have, based on the source of information, particularly when it comes to governments handling such issues, you know, in a situation wherein we have other elements of or other factors that threatens information sharing, looking at the social medias, be it whether opposition or other critics of governments. So it was smarter enough for our government of recently, again, just engage us in the preparedness for the recent concluded MPOX, you know, which I believe is the right track. But the preventive aspects, I think, which I believe this project should be focusing on, because when it comes to early detections, it remains more on the professionals. You know, that is to say, what I'm trying to suggest now, how we can link up with its public health units within the various districts, you know, when it comes to information sharing, because most times governments have their own bureaucracy in terms of how they can be able to filter out information. And again, because of the, I would say, a bit political context we are living in, you know, if information comes directly, certain information comes directly from government without the enforcement of either civil society or the social space, you know, it's threatening the flow of that information. I think that is one of our biggest threats in terms of handling, which we should focus on. So I think collaborations, I think, is very key here to see how best we reinforce or energize some of the things that we are about to work on. Because now the citizen is also coming. Because I was out when I saw only pandemic, because we are struggling with both pandemic and epidemic or other emergencies that do occur. For example, cholera outbreak. Now the rainy season is coming. We are expecting that. We don't know what the scale will be, because like you mentioned, or one of the speakers mentioned, we do have expertise or structures to handle some of this. But what about those other, emergencies that may arise? Is it that are we going to factor all of them within this project as a means of considerations, you know, for perfect inclusion? And again, the targeted populations, when it comes to general, because that's our problem we had even with the structures government sets. Specification is very key. When it talks about Ebola virus, it talks about COVID, it talks about even the recent MPOX, it's more threatening to persons with disabilities because they already have health challenges and other vulnerable groups. So we do want to see how best you can, this project can not only go general, but also to create specifications to address some of these targets that most times they will leave them behind, except we come back and start shouting or crying that, oh, these certain people have been left there before everybody can get them on board. So that's just briefly I want to say. Thank you so much for the opportunity.
Thank you, Bakari, for a lengthy reflection. John, do you want to jump in?
So I think yes. So thank you so much. That was more of a comment as also information. We are very appreciative of that. Now, please note that the session today is to introduce the project. You've mentioned a number of things that we have already packed them in the face-to-face training that we are going to have. So we are going to have a workshop in Sierra Leone. Those things you have mentioned, they are already in the program. So we will have more time to discuss both in Sierra Leone and also in Rwanda. I also want to mention that from the chat, we have a SysMatch that has been implementing PPR. working with UC Smart, I'm sure it can also have a relationship, very good relationship with the consortium. So we are more than happy to have organizations that are very experienced. Also, Rwanda NGO Forum, you have implemented PPR programs. So the mix that we have, there are in fact, Rwanda NGO Forum, we've done a lot. So the mix that we have, at least it brings us that momentum. It is easier for us to pick the advocacy agenda, and even with the resources that we have within AHF, design something, design tools, design an advocacy process that we can implement. So I think in the interest of time, we can pick maybe two and be very brief to the question, so at least we can get into the next session. We can transition to the next session. Yes, just two more, then we move in. Yes.
Yes, I see there are a lot of hands raised up. How about
So
we
can
keep
we
the
do maybe
questions on the chat box, and then
yes,
I'll come back
and
to
then we do
them.
at the
I'll
end.
I'll just read two questions. There was one from Safa. Is the project flexible for integrated programming? And then there's another one. Kennedy mentioned a rapid assessment document currently under review. How soon will this be shared to the 20 selected local NGOs so that we can align our current community engagement programs with the identified gaps? Yeah, those are the two questions. I think we can take them up, John, and then we can go ahead with the session and go back to the Q&A.
Yes.
At a later time.
Correct. Yeah. Yes. So PPR is all about integration. Can you imagine the 1,000,001 institutions that do pandemic preparedness in a country? If you break down the people who do pandemic preparedness and response, you will be surprised. Let's try. Do you know we have the Ministry of Health? Of course, usual suspect. We know that, all of us. Do you know we have the army? Then it starts getting complicated. Oh, how is the army? I'm sure Sierra Leone and Rwanda, we understand. The army is a stakeholder in PPR. Do you know we have the environment people? Do you know we have the wildlife people, livestock, under the One Health thing? So there are 1,000,001 stakeholders within PPR. So yes, when you talk about pandemic preparedness and response to health emergencies, you're talking about an integrated approach. The question is, at community level, how are you integrating the community health workers, the community health actors that you have as an NGO that you work with at grassroots level? How are they integrating all that? At national level, we will have the army coming into the meeting together with the environment, together with the wildlife, water and sanitation people. But at community level, how do you, that one community health workers, how are they equipped to do everything? They are very much integrated at the lowest level, and we expect them to perform miracles. But we will talk about this when we have the face-to-face workshop. The assessment, yes, it's ready. And I think my colleague Linda has shared with some of your teams at the country level. Maybe if they are comfortable, it can be shared widely with all the organizations that are in this process. So I think we can quickly move to and this one will be fairly easy, very quick. We want to break. Remember, colleagues, I just want to remind you, today we're introducing the project. Then the job starts today. We will have other face-to-face meetings at country level. Then we will have more time face-to-face to discuss and agree and co-create a program and implement together. So the first objective, I think we've seen, is an objective on stakeholder mapping. Stakeholder mapping was very important. That is why we have the organizations that were mapped here with us. So we have stakeholder mapping and engagement strategic approach that we are using. So we worked with your team at country level. Then we have the selected organizations that are in this meeting today. Then we will work with that. So we mapped out stakeholders, and we were glad to have the people who are here today. Then under objective 1 still, orientation and launch. Today is only on orientation. We're doing orientation today, but we will have a face-to-face launch meeting in the respective country, that we can have more in-depth discussion and launch the program. Somebody asked the question about integration. We will expect to have for example, in Sierra Leone, we'll expect to have our friends from the Public Health Institute. Why? Because this PPR is always integrated. We can't move without the public sector. Then, so we'll have some of the colleagues also participate and also be part of the discussion. So at least because they're the ones who are holding the plan, the strategic approach, the plans for the country. Then after that, those will be the launch meetings. Then we will have now under still objective one, a training session. So we are planning a workshop. So the way we have met today virtually, we will organize a face-to-face meeting in Rwanda and Sierra Leone. We'll sit down a number of days, go through the background of all this, what we are doing, and as a team, design something that we want to take forward as an advocacy agenda. So we will have that training component that is there in the form of a face-to-face workshop. Remember, today we are just introducing, but the implementation will also involve face-to-face. Then the second objective is enhancing public awareness and engagement in pandemic prevention. We'll now also have to talk about peer education, youth-led initiatives, village engagement, have come up with those strategies and have a way of advocacy component that can be able to take us to the next level. We will develop IEC materials, work and develop IEC materials on pandemic preparedness, health emergencies, in whatever area that we think is a challenge within our context, because we know Sierra Leone is very different from Rwanda. Rwanda is different from South Africa. South Africa is different from Kenya. So all these differences will influence the design of the IEC material. What do we want to communicate? What do we want to share and portray out there, based on the context, local context of our communities. The third objective will develop a sustainability toolkit to ensure that at least we have a toolkit and resources in that toolkit. We open it if you want risk communication, which Rwanda NGO Forum is doing very well in risk communication. Risk communication and community engagement. I think Rwanda NGO Forum, thank you so much, Noliet, for letting us know about that. They're doing a lot of that. So if you open that toolkit that we are going to have, we can have issues that can help us to do risk communication and community engagement. We can have early warning and the detection. You can have another tool so we'll have a number of tools that we can have in a toolbox that can be able to help us to integrate. Even CLM can be a tool, one of the tools in the toolbox. How do we look at that CLM? And I'm glad Sierra Leone has already done this. SysMat, I think and the coalition, you participated in this. So how do we have that as a tool? Because we have a tool, for example, CLM, but does CLM collect data on pandemic, PPR? Okay, there are a number of countries that have done this. I think we have Nigeria, Namibia, Malawi, Sierra Leone, I think like around 15 countries in our region that was supported by the Global Fund to
John, I think we can't hear you. John. Apologies, colleagues. John broke off for a minute. I think he has a connection issue. Oh, here you are. We lost you. Welcome back.
Hello, can you hear me?
Yes, we can hear you now. Welcome
I don't know
back.
what's happened, so I'm so sorry about that.
Yeah, maybe if you turn off your video, the connection will get better.
Okay, perfect,
Yeah,
perfect. So we will now look at the peer learning. Then we have Rwanda, Sierra Leone. How do we come together and share our experiences. There's a lot of experiences in the community, how communities responded Ebola issues in Sierra Leone. That is different from Rwanda. And there's a lot of Noliet Shizia. There's a lot of work that Noliet, who from the Rwanda NGO Forum, they're doing in risk communication and community engagement. How do we also have that experience shared with our colleagues from?
We lost you, John.
Yeah, John, we can't hear you. Let me try to ring him. Apologies, colleagues.
Just do.
Colleagues, can you hear me? Linda, can you confirm if you can hear me?
Yes, we can.
Sorry about that. There was a shift from the generator to the other power. So when that shift happens, disconnects the internet a little bit. So I'm so sorry about that. So implementation arrangement, we look at the ENASO at regional level. Let me share the screen quickly. Yeah, I'm also rushing through this because I think I've seen we have a number of hands up so that we can create some time for us to dialogue and to talk. So let me just rush through. Yes, as mentioned in ENASO, then we're working with organizations at country level to co-create. And we want this to have a very strong community ownership. That is one of our strategic approaches, the ENASO. We use the enhanced community engagement and communities taking leadership in design and implementation of programs. Timelines, we are a bit late for the first phase, but trust me, we have a fast track plan that we can condense a lot of things together. So the initial phase 1, that was supposed to be within Jan and March, the first quarter. We should have done this meeting in first quarter, but we are doing it now, and we are also coming to Sierra Leone for the face-to-face immediately after this, and Rwanda immediately after this. So we'll have to ensure that at least these activities are condensed and we implement together. Then the phase 2, that is April to September, I'm sure we'll be able to do those things that we've seen in Objective 1, 2, and 3. Then the last quarter, I think we'll be on time there. We'll be able to look at the sustainability and learning, sharing, generation of the toolkits and all that. Can work together and develop that and implement. So that's the key deliverables. We've done the mapping. I think that's why we are all here. Training sessions will be done. This will be a workshop model, face-to-face. Then awareness campaigns will be implemented. IC material developed. These are the deliverables that we expect to have in this program. Then the toolkit developed and distributed. Peer learning workshops conducted. So we'll should be able to have these as deliverables. So thank you so much. I know this last part, we've rushed it, but the first part was more important for us to get intimate with the program. So we had a number of hands up. I can ask Linda to take over. Maybe we can do the questions towards at the end when she's done the presentation. So please, if you have your question, just note it down or just put it in a chat box. Then we can also read and respond. Over to you, Linda.
Yeah, next slide. Oh yeah, I think you already covered this. This was just to show who will be doing what, both at regional level, as John mentioned, that will be ENASO, and at country level will be AHF. I think we have extensively exhausted this, we will be, as ENASO, will be providing the technical leadership under John, and project coordination under me. Designing of tools will also be done and led by our technical personnel, Mr. John Beku. Lead stakeholder engagement and training. So all the technical part will be done under ENASO as the technical lead, but cannot be fully synthesized without the support of the country teams, and that is where our partners AHF come in, who will be helping us in mobilizing and convening country stakeholders and communities. As John mentioned, we intend to do travels in both Rwanda and Sierra Leone for the physical engagements, and ensure they will also help us in ensuring that no one is left behind from the selected stakeholders here, just to ensure that everyone is going to be fully engaged. And yeah, I think that's how we work in coordination with both ENASO and AHF, and to ensure that everyone here is fully engaged from now to the end of the project. Next slide, John. And now I think we can go straight ahead to the Q&A section. I will start with the questions in the chat box just to get them out of the way. We have a question from Caragua. I'm apologies if I am butchering your name. For those of us in Rwanda and colleagues familiar with our journey, we have successfully moved from single disease CLM to implementing integrated community-led monitoring, ICLM. I shared our progress on this during the last ENASO convention here in Rwanda. But as we know, ICLM is currently focused on the 3 global fund diseases, HIV, TB, and LIO. I strongly believe this same community-led approach is the missing link for pandemic preparedness and response. For other emerging diseases, expanding ICLM is essential to sustaining the system so that they don't rely on single donor. My question is, how can we work together as a consortium to share lessons from the ICLM transition and use that evidence to jointly lobby for the integration of PPR indicators into our existing national community monitoring frameworks? Yeah, that was a handful. John, do you want to take this up, or do you want to take another question?
Yes, so very quickly to that is very encouraging that we have ICLM in Rwanda implemented, integrating the diseases. That's okay. Then we also need to, if you want to integrate PPR, that's another opportunity. Maybe you're also already integrating PPR, but you also need to look at the indicators that are specific to PPR, first of all. That's the beginning. So this opportunity for this project gives us the opportunity to think outside the box and see all these integrated diseases that we have and our CLM can monitor, all the diseases, sexual reproductive health, HIV, TB, malaria, non-communicable diseases, everything else. But the question is, all those indicators, if you look at, is there any one or two that helps you to contribute towards PPR? So then this project will give us an opportunity when we meet face to face to reflect on that. And we say, oh, no, we have looked at our indicators, maybe no. Then we need to integrate. Then we can create a project to integrate. If we have already integrated it perfect, then it becomes a sharing point that you have mentioned. How do we share these experiences? So now it becomes a learning lesson that we, and also that we implement the webinars that we normally bring the whole region together to present, showcase work that is happening. We can use some of this platform to ensure. The first platform is this project. We will have the cross-pollination, sharing, learning from each other, seeking a solution to troubleshoot some things, then we will do that. But beyond this project, we can plug into ongoing platforms that help us to showcase what we are doing for other countries, communities to learn from. Where the Learning Hub within the ENASO can be able to be one of the platform that does, and we can even create our own within ENASO under this project, much bigger webinars that can bring other stakeholders that are not in this. And then we have picked some of the projects that we are doing, we showcase. Yes, that would be my quick response to that. Yes?
Yeah, yes. Yes, John, thank you for very much. Yeah, just to piggyback on that, as ENASO, we're big on sharing what we know and lesson learning. So I think this could be, as John said, could be a great way to showcase our expertise and cross-learn from other countries. I remember Dr. Dale had a question, but we had to take it to this session. Dr. Dale, you're welcome if you still have the question.
Thank you very much for the presentation, and great thanks to the AHF. I think I would say that this is a piloting phase. It's an opportunity that can create more opportunity for a long run, and making it's just an idea, not a question, to make sure that the way we document the success story and the way we document our data that we have been using we have collected through this support as PRHIV network or umbrella for people living with HIV in Rwanda. We believe that part of the pandemic preparedness that has been lacking some key interventions, which I believe that it will be helpful to unpack and make sure that the response is really a community-based result, then from down to top as solutions towards sustainability and making sure that the user services and the community that is well-centered are on the response for a pandemic that is, I mean, to show that there is readiness to any pandemic that might arise. Another thing is about education. I don't know, probably for which we'll be discussing when we come face to face, will be a need to create something like indicators reflecting on community education about different interventions, especially on PPL as a sustainable response towards gaining towards documenting and making sure that community are well centered in terms of not only having the information, but even playing a central role of really a central role in terms of engagement. I would probably ask anything related with the end line about this, since it is a short-term project, which is now almost 6 months. I would probably suggest that we should think to have an end line best practice that can be an opportunity to sell in other setup where a NASO and the AHF spaces that they reach where we cannot reach, then we can have that information shared and sell it. Probably can create an opportunity for communities to remain into implementation in the meantime. That's what I want to contribute towards this opportunity. Thank you.
Yeah. Thank you, Dr. Bell.
Thank you. Yeah. Thank you. Thank you so much. That is very critical. So endline does fine perfectly. We document and we will package all the best practices that we get from this project as we go. That will be very critical. Now, you've mentioned something that is very critical. I think as a team who are here, we can use this, as Dr. Dale has mentioned, as an entry process into a bigger world of PPR. So if we can implement this and have a one target that by the end of this program, we can now be able to request our supporters and approach beyond AHF to get more support for this program and create a new program, more long-term, more in-depth. It will be very, very beautiful. But we can do it together as a team, a consortium. This can be already starting to have a consortium of people who are in the organization who are in this project and walk the journey. Because we understand the World Bank has a lot of support for communities at regional level and country level for pandemic preparedness. But how are we positioning ourselves at regional perspective to be able to have one program that can help support those initiatives? So I like that idea of having this as an entry point, but let's think bigger and see how, as we implement this, how can we package this and ensure at least it opens doors for other. Yes, Linda.
Yes, thank you. I see there's some reflections in the chat box, and we'll be taking questions from Joseph, Ayamba, and Buya. So I'll just read the reflections. In this project, among key deliverables, we're talking awareness. In my opinion, on how to do these campaigns, we add linkages with health facilities and for sustainability. That's a reflection from Mwananawe. Thank you so much. Yeah, I think that is something we should definitely be looking into. Yeah, John? Working with health facilities for sustainability.
Yes, the linkages with what is our entry point to working with the formal health infrastructure. That linkage is what the connection now, what Mwananawe is bringing up. And that's what we also target. And that's one of the gaps that we have. Thank you, Linda.
Perfect. There is a question from Joseph. Oh, Joseph, yeah, come in. You're welcome. Joseph, you can speak.
Can you hear me?
Yes, we can.
Okay, I said thank you so much for the very clear presentation. One of the things I'm sure we need to probably think, I don't know if it is in the details of the proposal, but I see something that has to do with awareness creation. And I see during the Ebola, during the COVID, and most of the emergencies that we do in Sierra Leone, I see people using techniques that in the end are not effective, especially in rural areas where they're using IC materials that people cannot even read and write. And so in the end, there is massive dissemination of information. But as to who actually benefits from this information and whether they actually understand whatever messages that we want to disseminate to them is another question. Given that this is a pilot, I would like to share some of our experience that we need to be able to probably start thinking about how we can incorporate, community radios, community theater groups, or maybe drama, or maybe, especially now that social media has become one of the things that people live with every day, even in the rural areas, even if they don't know how to read and write, they have phones that they listen to, watch movies or short videos or on YouTube or other diseases. So we need to think about a multi-pronged approach that makes the communication, because I think it is one of the areas that is highly emphasized. So if we want people to really get some of this information or communicate well, I think the strategies that we use here has to be carefully thought. In the past, we have used posters, we have used this, and how many people actually read them and take time to do that. So we have to be able to think about what are the appropriate strategies that we can use when it comes to community engagement or awareness creation. Thank you so much. And one last thing is also about now, for example, Sierra Leone, social media and content creators are becoming very powerful. Is it a way to actually reorient them or capacitate them to use some of these platforms also on such a project? That's my suggestion.
Okay, thank you so much.
Yes, I think that's very critical, and you have already started working. So when we meet now face to face, that's the information that and the guidance that we are looking for. Technology that is relevant approaches, relevant strategies, and relevant technology. relevance is very important. Something that is applicable and actually fits what is happening within community. So we don't have to reinvent the wheel, do the same old things that are not effective, that we are not communicating anymore. Communities have even moved ahead of us. They are doing so much in social media more than us. What do we do to be able to now catch up with this kind of appropriate technology to reach? The most important part is to reach. Yes, I think, yeah, and again, the content creators, social media people, there are people who are actually becoming billionaires now because what they say everybody listens to. And they hold a very big microphone that reaches everybody. So how do we ensure that at least even the community ones who have that kind of platform can be engaged? Yes, Linda?
Yes, thank you. I see we have a lot of questions and we are only 6 minutes left. So I think for the following speakers, just keep your reflection 30 seconds top. I hope that is possible. Buya coming.
Yes, good afternoon, everyone. Buya here from Sierra Leone. Yeah, thank you. Thank you so much for the session, and thanks to AHF and the entire team for that. Quick reflections. Mine is for the possibility of this project to target adolescent and youth community-led research systems, where if we're targeting any engagement, we should also look at that, because these young people are into these communities, and if they do locally led research for themselves, they can promote ownership and they can promote optimization of all of our target points. And second point is on the need to possibly see how we could design a PPL resource hub. I don't know, I think you mentioned something about that quite similarly earlier. I believe if we have a resource hub that if I want to check for materials, the latest today on PPL, I can check from colleagues in Rwanda, colleagues in other countries could also benefit from that resource hub. So it can be already available strategies and interventions or maybe tools that we could use. I'm saying this, for example, we're trying to, maybe because of time, but when we get our in-country sessions, we'll have more details. But we need to think about having PPL resource hub for enhancement of our interventions. And secondly, again, I talked about the adolescent and youth community-led research systems, because that way we promote ownership and all of that. Thank you, and over.
Oh, thank you so much. Yes, John?
Yes, so that's fine. And I'm glad to hear community-led research. We really tried, and I'm sure you remember during the GC7, it was stopped a little bit by Global Fund, but I think it has picked. But if we have these initiatives in a country level, we are talking about decolonization here of research, generation and utilization of strategic information. So this is beautiful. So that is something that can add value a lot in the project. The resource hub, and I'm already thinking, maybe that resource hub we can have it as a broader concept, but under that we can have the tools, other resources, and everything else. And as a team, if we meet and we agree, we can create community of practice, so that at least other than just the hub, we can also have a community of practice that is active and in the region, and to spearhead PPR conversations. People want quick answers, where to go, where to find something. They can be able to get into the community of practice and be able to engage. And that and also can try to see how we can mobilize resources now to fundraise for that, so that at least we can host it and ensure at least we have topical discussions ongoing. So at least that resource hub is more broader and can respond to many things. Yes, Linda?
Thank you so much. I think there's so much we need to discuss, and as John mentioned, we are going to have in-country engagements where we will not have only 1.5 hour. And so I think we can continue the discussion going in our social media platforms at ENASO. If you search ENASO, you'll get us on social media. I want to do just one exercise. John, can you stop the screen? And everybody, can you help me turn on your cameras so that we can put the faces to the names? Anyone who can turn on our camera, I'll be very grateful. Yes.
Sorry, I can only see my mic from this end. I'm not seeing a camera. I don't know if that was disabled from the host end.
It's from the hosting.
Jackson, can you help us fix that?
From the hosting, I think you need to, as a host, you need to say, allow everybody.
Okay.
Make everybody a host.
Jackson, can you help us with that?
Hi, Dr. Lambert.
Hi, Esther.
Happy to see you today.
Okay, I think unfortunately it cannot be done, but
We can't see ourselves where we can pray our cameras.
okay, I think we'll just save the faces for the physical engagement. But just to close off, I'm really thankful for everyone who was here. Thank you for your time and your very active engagement. Apologies for those who we could not take up your questions, but don't fret. In the coming weeks, we'll be having physical engagements in both Sierra Leone and Rwanda, and we look forward to seeing you all and engaging more and learning from you. Thank you, and that's from us, Nina. So, John, do you have any final words
No, I
before
just want to say thank you so much, Esther. Thank you so much, Daktari Rwanda. It's nice to see you again. I know we had a quick chat when we were in Rwanda a few months ago, but this is really nice to meet you. And thank you so much, community organizations, for this opportunity. Please, let's scale it up and let's try to design something that can be a movement and put the communities right in the middle of PPR and playing their rightful leadership role in addressing pandemics and health emergencies. Thank you so much, and over to you, Linda. You are muted, I think.
I think he's already crossed the meeting.
Oh, okay. I mean, all resources will be shared. Will be shared in our website. Make sure you subscribe to our newsletter, and we'll also share posts in the AHF social medias. Thank you very much, everyone, and have a good afternoon. Bye-bye.
Thank you. Thank you. Bye.
Thank you, Linda. Bye-bye.
Bye.
Bye.
Bye. Bye.
Bye.